everyone. Once more, thank you for joining us on yet another edition of the program You and Your Health aired on Equinoxe Radio Multimedia. For presentation, I am Immaculate Fogwe. Last week, we talked about teeth hygiene. We talked about how to take care of our teeth. This time around, we'll still be focusing on the mouth, but on something else. We'll be talking about taking good care of our tongue. The tongue is known to be one of the essential parts of the human body because if you're unable to taste food, then how then do you know that food is good? But how then do you take care of that tongue is what we are going to be revealing after the short break. Welcome back. With me here in the studio is Dr. Mfo Kelmed, a dentist at the Emmanuel Dental Clinic here in the city of Douala. It is a pleasure having you once more in the studio, Doctor.
Good afternoon, Emanuela. Good afternoon to the listeners and the televiewers of Equinoxe Television, and most especially this wonderful program, You on Your Health. And I want to thank you for an invitation once more to share on health.
Exactly. We are still going to be focusing on the mouth, but this time around we'll be looking at the tongue. What role does the tongue play in the human system?
Well, the tongue is an organ that, like you rightly said, that helps to taste food, and it plays, that's the major role that the tongue plays in the mouth. Mm-hmm. And also, with this importance, we see that it has a role in auto-cleansing of the mouth. Mm-hmm. So this organ is an organ which we need to really take care of it, and we need to really be proud of this organ. And the consequences associated to the non-care of this organ is very, very disastrous. Reasons why we need to put an asterisk on this organ.
Okay, now we are going to be talking about halitosis, or equally known in English as mouth odor. What is it all about?
Okay, thank you very much. Mouth odor is an oral health problem which is characterized by an offensive smell that comes from the mouth. And it comes from the mouth, but it can have other origins, such as the other systems, such as the respiratory system, the digestive system, and even other organs. As a dentist, our concern are these mouth odor that comes directly from the mouth, which we are going to be talking about.
Okay, so now tell us, what are the major causes of mouth odor?
Mouth odor has a multifactorial cause, and like I said, we could have extraoral and intraoral. Mm-hmm. For extraoral, we could have the respiratory system, the digestive system that are incriminated. We could have also some structures like the tonsils. So the tonsils are the structures that are behind the tongue, which can get infected, and you suffer from tonsillitis. Some mm-hmm. tonsillitis that will bring forth this unpleasant smell. But 90% of causes of halitosis are from the mouth. And the first cause is poor oral hygiene. When we don't brush the way we are supposed to brush, we belittle much on brushing, especially the tongue. The tongue is where there is putrefaction, where the food debris get stuck in. Mm-hmm. When we don't brush this part very well, there is that unpleasant smell that is produced. Another cause of halitosis, bad breath, or mouth odor, I'm going to be using the various terms. Mm-hmm. Another cause is dental caries. Dental caries is simply a hole which is formed on the tooth, and when this hole is formed, food debris gets in, and when they get in, they get decayed. You can imagine with me the kind of smell that is produced from decayed food. So when you open your mouth, you speak, there is that unpleasant smell. Another cause could be what we call periodontal diseases. Periodontal diseases are just diseases that affect the structure supporting the tooth. When like the gum, the bone, and all that. So when we have some disorders on the gum, in the long run, we can have this smell that is being produced. We could have what we still on the periodontal disease, what we call periodontal pockets. What are they? There are spaces in between the teeth where food gets in and gets impacted. most of the time when the food gets impacted, we struggle to use toothpick
exactly
to remove that, and we really advise people not to use toothpick, because when you use that, you prick the gum and you create that corridor, and when you enlarge the corridor, the food gets in and gets stuck and it decays. When it decays, really the smell that should come from your mouth won't be
the best.
Yeah. And another cause too is those who put on artificial devices in the mouth.
Okay.
Those who put on artificial devices
like
we make mention of removable partial dentures. These are structures which we put to replace teeth, and we tell our patients to do cleaning in the morning or after eating. Some don't respect that, and the food gets stuck in between these objects and gets decayed, and the smell from that, it's not really welcome. So they need to clean this object. Another cause could be xerophthomia or dry mouth. Dry mouth, as I'm talking, there is saliva that is produced that does an auto cleansing of the mouth. Okay. So when you suffer from xerophthomia, which is lack of saliva, there's no cleansing process in the mouth. So the food which you eat gets stuck around the teeth. So they form plaques. Last week I talked about plaques, which was an association of food debris, saliva, and bacteria. They get calcified around the teeth, and when they get calcified, we call that calculus. And there is that smell that comes when you will notice with people when they smile. So there's kind of brown patches around the teeth. That's what we call tartar, which brings forth that smell. Other causes too, which we could term them physiological. That is temporal, and it's always discovered, let's say, fortuitously when we eat like food like garlic, onions, and all that.
That's just for a while, right?
Yeah, that's just for a while. So we call that temporal halitosis. Meanwhile, the other ones have been given are really the core pathological halitosis. Some people will take some drugs report of halitosis too, like hypertensive drugs and all that. And other causes. I think with these, there are many causes which we can talk about.
Let's now look at some health problems that could equally result to that. Intrinsic.
For intrinsic
Yes.
intrinsic consequences
Exactly.
of
Mouth odor.
The first consequence is psychological. Loss of self-esteem. You can imagine being with your colleague, with your spouse, with your friends, and you happen to talk, and the kind of reaction towards you, it's not welcoming.
I can just imagine that already.
So you see, that's the first consequence. That is that psychological distress, loss of self-esteem, and even embarrassment. That's why some people, they don't speak in public, or they don't speak so close to others, or they speak with a kind of hand barrier, because they don't want to let's say offend the other. For those who know they have that,
Exactly.
they don't want to offend the other. So it's that's one of the major consequences of this halitosis.
But I think it's not in all cases, because you have some people who have mouth odor and they try to come and speak in front of your face. So
Yeah.
sometimes is it that they don't know? Sometimes they are aware, sometimes they are not aware. But now I want to know, how can I tell I have mouth odor?
Well,
Must it be someone to tell me that you have mouth odor, or I can equally know by
mouth
myself?
odor first is a subjective examination. Let's say. You are the first person to know, even though you said some people don't. Well, you can take your hand, so you cover your nose. You cover your mouth and your nose at once. You try to breathe in, and you discover that if it's so recurrent, then there is a problem.
Okay.
But most of the time, the audience, so your entourage, they are the ones that tell you. For those who have courage to tell, because
it can be hard, right?
Yeah, it can be
telling
hard
somebody
to tell your spouse or your
mouth
friend
smells.
your mouth smells. But it's very important to tell.
But there are some little etiquettes, like I can give you a gum of mint, that has mint in it. That's another way of telling you have mouth odor. Some people do that, but not everyone will understand that's the reason.
That's a cordial way
of doing that.
Mm-hmm.
Okay, now we'll be displaying our numbers where you can call and participate in the program. You can call and ask questions concerning mouth odor. And the numbers are 655-511111. The next number will be 652-025050. You can call and ask questions when it comes to mouth odor. We are here to answer all of those questions. So now, doctor, does the way you talked about brushing the tongue, how do we brush our tongue?
I think last in our previous edition, we're talking about the teeth, and today we are going to talk about the tongue. Really, the tongue. While brushing your tongue, it's an organ which you need to take time first, because it's rough. It contains papillae, some rugae, so you need to take your time. Really move. That is a front and backward movement on the tongue, making sure that all the white patches on the surfaces are off. Some pharmaceutical companies do a great job by producing a special toothbrush. If you look at the back of the toothbrush, you see some rough surfaces that permit you to scrape your tongue, especially those who have neglected the tongue for a while, and that.
We have a call on the line. We're coming back to that question. Hello.
Hello.
Yes, hello.
Yes.
Good afternoon. Your name, where you're calling from, and your question.
Hello.
Yes, sir. We are getting you. Can you turn off your receiver so we can get you clearly? We just lost that caller. Please, before you want to participate in the program, make sure your TV or your radio set is turned off so we can easily get you, because when it's on, the connection is really poor. So we're talking about taking care of the tongue and how to brush it.
Yeah, I was saying that some pharmaceutical companies produce the toothbrush in which the back of the toothbrush has a kind of rough-like surfaces in which you can actually scrape the tongue very well. And after you do that, you do a rinse of the tongue, and you do that on a mirror so that you can observe for yourself and judge for yourself that you're doing a great job.
We have another call on the line. Hello.
Hello, my name is Kum James.
Okay, where are you calling from and your question?
I'm calling from Izange.
Okay.
My teeth has some holes. I don't know which type of toothpaste I can use.
Have you visited a doctor? A dentist? Okay, he said his teeth has holes, and I don't know if he has already visited a dentist or whatever, but I think you can still give him a remedy for that.
Yes, we said for caries, so the treatment of dental caries, the hole on the tooth is dental caries. You need to calm, because the treatment is mechanical, and so using a toothpaste won't solve the problem. Because some people think that when that hole is created, if I have to prescribe a toothpaste, the toothpaste might help. No, come to the dentist. There we would do a proper diagnosis, then establish a treatment plan for you, and you'll be relieved from the pains associated to that dental caries. So I think he should come for consultation.
We have another call on the line. Hello. We just lost that caller. So now, let's now talk about someone who has chronic mouth odor. Even after brushing the teeth, as you have explained, can things change?
Well, things can change depending on the cause of the halitosis. I made mention that if he has a hole, and full impaction inside, or he has periodontal pocket, or he has started build-up, he might brush from now till
nothing will change.
Nothing will change. So he has to come. Then we would do, let's say, professional cleaning. We would treat the caries. We would try to get rid of the food debris in the hole. Then it would solve.
Sorry, we'll have to stop somewhere. We have a call on the line. Hello. We just lost that caller. Yeah.
So he would come to the dentist. Then we would have to do the establish the treatment plan that will clean up the mouth professionally. And if the halitosis is from other systems, let's say the respiratory, the digestive system, we would refer them to the physicians in charge, in which they will do the diagnosis, and they too would look for a treatment plan, and the solutions will be attained.
And is halitosis transmissible?
No. I don't think halitosis is transmissible.
Oh, okay.
Because some people believe that that question is really important, because we have some families who come to the hospital. Oh, everyone, my daughters, all of them, they have this mouth breath. Doctor, what can I do? What can I do? And I tell them that if there is bad breath, the thing should be the hygiene. Look at the hygiene, the family hygiene. Do you put brush morning and evening? Okay. And how do you do the brushing? So do you just take 30 or 20 seconds, you just do whatever? No, take your time. And I want to call on parents. So teach the children from the onset how to brush. So supervise them on these brushing habits, so that when they develop the skills in brushing, you can never depart from them. For sure.
In the case where you have a spouse where the person has halitosis, so it can't be transmissible, something like that?
No, it can't be transmissible. It can't be.
So now, let's now talk about, let's say, how can we look in the context of Cameroon. Is it common in Cameroon?
Yeah, halitosis is becoming more and more an object for consultation, because people come now, because of the consequences which we made mention about. Many people come to the dentist. Most of the times we have patients being referred from our colleagues, the general practitioners. We say evaluation should be done
by a dentist.
Yes, by a dentist to look at the cause of this halitosis, and it's so common. And we have mostly the ages between 20 to 40 who come for this consultation, and we have also the old adults who are also so prone to.
We have a call on the line. We'll come back to that. Hello. All along. Network, I don't know what's really wrong. You guys should try persisting. We are going to answer all your questions concerning mouth odor for sure. So, back to you, Doc.
Okay, I was saying that we have also the old adults who also face this problem, halitosis.
As a dentist, what is the major difficulty you've faced while consulting people with halitosis?
Well, the major difficulty is that it's something subjective. So the patient has to tell you, and the person has to tell you that, doctor, this is what it is. But on the other hand, too, we have to, in order to diagnose the halitosis, you have to smell too. Well, it's our rule. We took an oath to do that. So
I think I will have to stop you somehow. We have another call on the line. Hello.
Hello, good afternoon.
Good afternoon, sir.
My name is Prince. I'm calling from Douala. Good afternoon, Dr. Kelmet.
Good afternoon, Prince.
So, I want to know, when you have an injury on your tongue, can it affect or lead to mouth odor? Because sometimes most of our toothbrushes are so hard and sometimes cause injury in the tongue. For those of us who do have injury in the tongue, what should they do? That's just my question. Thank you.
Okay.
We have another call on the line? Okay. So.
Okay. All right. Thank you very much for that question. I want to first point out the fact that you shouldn't use a hard toothbrush. The consequences of using a hard toothbrush is what you mentioned. So bringing out some holes on the tooth. So your toothbrush is supposed to be, the bristles are supposed to be supple, and if you are keen on some toothbrush, they always write medium is the one that is good. So when you have a wound or whatever on the tongue, an ulceration on the tongue, it's very difficult. I bet it's very difficult for you to brush.
Exactly.
And it can be
very painful too.
Yeah, it's very painful. So you just come for consultation. I think we have some products in which we can do, or some mouthwash which we can prescribe that will help first curb the ulcerations or the pain, and later on then we see how to, or consequently we see about the mouth odor, either teeth cleaning or tongue scraping in the hospital and other.
Okay, for someone who is suffering with halitosis, is there a particular way or a specific manner in which they can improve on their dental hygiene at that moment that it can be different from someone who doesn't have that problem?
First of all, the hygiene is supposed to be up to date or up to point, because the brushing morning and evening is very important. And I laid emphasis last time about brushing in the evening, because in the evening your mouth is closed. And when your mouth is closed, if you have food debris around the teeth, so the bacteria will act on this food debris, and create a blue film of plaques and create calculus, which would adhere to the teeth. And we'll continue mentioning that because it's one of the causes which we observe mostly in the hospital. So the hygiene is supposed to be so rigorous that the person is supposed to observe that as much as possible.
We have a call on the line. Hello. Okay, we just lost that caller. So now, what are the different treatment options for bad breath?
Okay, first, bad breath. If you suffer from that, there are two options. I will first talk about the home remedy, and later talk about what you should do if it's so recurrent, if it becomes so recurrent and unbearable, which you have to come to the dentist. Home remedy, first, brushing at least twice a day. Now, you floss using a dental floss. A dental floss is a thread-like object which some do have a handle. You get in between the teeth, and you remove the food debris that might be stuck in between. Not using a toothpick. When you remove that, it doesn't have some kind of manual dexterity problem, because you easily do away with the food debris.
Talking about that, it was going to be difficult for us to use that on the molars compared to a toothpick.
Well, really, that's why there is. I talked about the one with the handle.
Okay.
So the one with the handle is so good, and it gets right to even the wisdom tooth. It can. But using the thread itself, that's where many patients complain that doctor, they can't. So with that, too, we prescribe when you come to the hospital. Now, in the hospital, then we diagnose that. We see if it's as a result of hygiene. We first motivate you onto this hygiene. We'll tell you the importance, because many don't see the importance of brushing. Afterwards, we can do professional cleaning for you. Professional cleaning, we have machines for that, and we scale and we polish your teeth and remove all the food debris, remove all what if it's a result of dental caries, we remove all the food in the hole, and we do our obturation. If I think those are the various options, then we can prescribe a mouthwash for you, a specific antiseptic mouthwash, which will give you a refreshing breath. We can also prescribe some of us sugarless chewing gum for you. And those who suffer from xerophobia, we will always advise them to always be hydrated, to take in water as much as possible, so that the mouth will not remain dry.
Before we end the program, I wanted to give you a last word concerning those who are suffering halitosis. What advice do you have for them?
Well, if you're suffering from halitosis and you know that you suffer from that, you should not be halitophobic. Come to the dentist. Come to the dentist. Proper diagnosis is done, and we would establish a treatment plan for you. Now, if you still have the physiological type, then you should brush, you should floss, you should you should advise also others. Let's advise others, especially those close to you. Give them advice. Oh, your mouth is your mouth.
Though it's hard because someone can take it like see it as rude. Some people might not take it just simple as you think.
Well, it's the manner in which you approach them.
Yeah,
it's the manner in which you approach them. You
don't just see people in front of people and you're like, your mouth smells.
Your mouth smells.
You're right. Yeah.
And you tell them that there is dentists today. They are able to take care of that because many people don't really think there is a solution. For some, they don't think there is a solution for that. So I think that should be the watchword this evening for those suffering from that. There is a solution, and they seek the solutions to this because it can really be embarrassing.
Exactly. And that's it for today's package of the program, You're in Your Health. For presentation, I am Immaculate Fogwe, and I had as guest Dr. Ufor Kelmet, a dentist here in the city of Douala. For technical assistance, that was done by Frame Yemeli. Have a lovely day in the company of more programs on Equinoxe Radio and Television. So long.
Vous écoutez Radio Equinoxe, la chaîne du peuple.
La chaîne du peuple.